Hi everybody, I hope this finds you well. I'm Heather Knox, Chief Executive here in NHS Lanarkshire, and this is my weekly video for all staff. I'll start off today just by running through quickly the COVID numbers. They are up a bit this week again, 86 inpatients across our sites in Lanarkshire and around 58 new cases presenting. So it's up a bit. I'm not quite sure what it's going to do, and I was asking Scottish Government colleagues this morning for some information around it. They think it's related to the schools going back, so I'm hoping it's not the beginning of another wave, but that it is a blip in the data, slight increase due to the schools going back. So hopefully that will start to even out again over the next few weeks, but nothing like the numbers we had about a month ago. I wanted to talk a bit about the Staffing Summit, which I trailed with you a few weeks ago before I went on holiday. We had that meeting last week. That was an in-person meeting. We haven't had many of them recently, so it was lovely to see everybody. And we covered a lot of information around how we can improve our recruitment and retention of our nursing workforce in particular. There were some specific things we agreed as a result of that summit, which was organised in partnership with our partnership and staff side colleagues. And we will be giving more detailed feedback, but some of the highlights just for you to hear from me as a result of that day. We will do an exit survey as to why people are leaving nursing and try and understand that a bit better. Our Executive Nurse Director, Eddie Docherty, is going to lead a piece of work on how we can best use Band 4s now that those job descriptions are available and ready for implementation. There are some issues around how we use them within a ward context, particularly where there are gaps in registrants, because they obviously need supervision. So that would need to be done carefully, but we are going to have a group looking at how we can best do that across Lanarkshire. Employability and bringing people into employment who've maybe had some barriers to employment in the past is something I'm personally passionate about. And we've done quite a lot of work on that already within Lanarkshire. But we need to make careers really attractive. I think we need to get some stories out, some success stories out about pathways to employment, and also just make it really clear that it's a great job. Nursing is a great job, and we need to encourage more people to come into nursing. So these stories, personal stories, is something I'm quite keen to share. We need to proactively recruit, and I'm quite keen that we go out and talk to people, maybe in shopping centres, schools, places of further education, about how to apply for jobs in Lanarkshire, make it really easy, maybe try and sign them up there and then. We did some of this work during COVID, and I think we probably need to go back to that and look at really creative ways of bringing people into the workforce. And finally, there's quite a lot of work we need to do around bank and how we offer out bank shifts in nursing and midwifery, looking at rostering slightly differently and what more we can do to bring people in when we need them on our bank rather than going for agency. Because I think if we were a bit more creative around some of our bank shifts, I was hearing from staff at the summit that maybe some of them would take up some of these shorter shifts, for example. So that was the feedback from the Staffing Summit. I've got an ask for you today, and we are doing some work on our digital strategy. So there will be a link sent round for you to complete a survey around how you use digital access for systems to support delivery of healthcare. I'd be really keen if you could just spend 5 minutes filling that in. We're also asking patients and local residents to fill it in, but as members of staff, we really value your feedback. And finally, just to say a really good piece of news, both the acute services team and the community team have been successfully put forward for recommendation for baby-friendly accreditation. This is a UNICEF accreditation, much coveted, and there's a huge amount of work goes into getting meeting the standards for that particular accreditation. So I'm really, really proud of our acute and community teams that they have managed to get to that standard of care. Thank you so much, and thanks for listening.